Welcome to our AAA 1B MAP update training on MIPPA, the Medicare Improvement for Patients and Providers Act. On July 15, 2008, Congress enacted the Medicare Improvements for Patients and Providers Act of 2008, or MIPPA. MIPPA is a multifaceted piece of legislation containing several important provisions that directly changed the Medicare program and allocated federal funding for state health insurance assistance programs, or SHIP, area agencies on aging, and aging and disability resource centers to provide outreach to low-income Medicare beneficiaries to increase enrollment in Medicare low-income assistance programs. MIPPA's goals are to identify if the Medicare beneficiary is likely to be eligible for Medicare Part D Low-Income Subsidy, or LIS, which helps pay the prescription copays and deductibles, and Medicare Savings Program, MSP, which helps pay the Part B premium and copay. To assist beneficiaries to apply for these benefits, and to provide education and outreach activities about Medicare prevention and wellness benefits. There are several parts to completing a MIPPA application. For LIS assistance, the actual application itself is done through Social Security at www.ssa.gov. For MIPPA assistance, the application is done through MDHHS MyBridges webpage at www.newmybridges.michigan.gov. Paper applications are also available from our office and can be downloaded. Beneficiaries can also ask for assistance at their DHHS office. However, the preferred method for completing an application for both MSP and LIS is online. This presentation will not focus on how to complete an actual LIS or MSP application. Questions in this process can be covered in full at the June 2018 hands-on training. The focus of this presentation will be on how to completely and accurately enter the MSP and LIS information into SHIP tools, how to complete the internal process of submitting the required paperwork to move the application and reimbursement forward, and a brief overview of health and wellness reimbursement. MIPPA reimbursement. AAA 1B MAP program is a MIPPA partner agency. As such, we get reimbursed for complete MIPPA applications, which include filling out and submitting. The reimbursement component for these applications is relatively new and was started both as an incentive to get more applications done and as an acknowledgement of the extra work that is required to complete an application. However, there is a limited pool of money available for MIPPA applications. Once the money is gone, we no longer get reimbursed. Thus, it is important to reach out and complete applications in a timely manner to ensure that the beneficiary gets the help they need and that our MAP program can take advantage of this extra pool of money. A word about reimbursement. It's not all about the money. MIPPA is important to help people get benefits they might otherwise not get, which for some people can truly be a matter of life and death. We emphasize reimbursement as this helps to keep our program running. Without proper reimbursement, we cannot continue to provide these services to individuals. Reporting our work is necessary. Aside from enabling us to get reimbursement, reporting provides continuity of care between counselors and tells the story of how we are benefiting people. It provides hard data rather than feel-good stories that show concretely who we helped, how many people we have helped, and how much money we have saved them. The federal government is looking very closely at our programs. All this can help our prospects for future funding. It is important to note that if information is not reported correctly, it does not count. And as we always say, if it's not reported, it didn't happen. Additionally, complete and accurate reporting is a requirement and expectation for doing MIPPA and MAP. We want you to receive credit for your work and can only do so with complete and accurate documentation. So who needs an application assistance? It is important to both keep people linked up with all benefits they are entitled to, as well as to find new applicants. Applications should be filled out for first-time applicants who might just be qualifying, or perhaps qualified for a while but did not have anyone to help them with the application or did not know they were eligible. First-time applicants also include people aging into Medicare from the Healthy Michigan program or disabled individuals who have met their 24-month requirement to apply for Medicare. Current MSP recipients wishing to increase benefit levels, example QI persons submitting for QMB, have a caseworker and should contact them rather than start a new application. As noted previously, one of the goals of MIPPA is to assist beneficiaries with applications. Application assistance is considered filling out and submitting complete applications. We know no one likes to do data entry. However, all information must be entered into ShipTools. Please note, putting the information into ShipTools is a requirement of ACL. Once a month, our ShipTools data is uploaded into ACL's Master ShipTools database. If the information is not there, there is no credit either towards reimbursement or client contact time. Application assistance is not screening for LIS and MSP, mailing incomplete paper applications to beneficiaries, submitting an application for MSP and counting applicant is deemed eligible for LIS. If you work on an application over the phone and send it to a beneficiary for signature, they must return it or we get no MIPPA credit. If they submit it themselves, it does not count towards application assistance. You can send them a self-addressed stamped envelope. Postage can be reimbursed. It can come to our Southfield office and we can take it from there. Who can apply for LIS and MSP? There are income and asset requirements for LIS and MSP applications. These requirements change every year. New requirements will always be found in ShipTools library under the purple color job aid for MSP and the yellow color job aid for LIS. The remainder of this presentation will review the requirements and go through how to document this information in ShipTools. LIS helps pay the Part D prescription deductible. The next two slides show the income limits for LIS through February of 2018. This is noted on your yellow sheet, which can be found in ShipTools. If you don't have this sheet or cannot locate it on ShipTools, contact your site coordinator, who will be happy to send you a copy. If you believe someone is close to meeting the requirements, fill out the application. It is not our job to determine if someone is eligible, but to assist those that might be eligible. There are 14 insurance companies in Michigan offering 24 different Part D plans to choose from for LIS assistance. Monthly premiums range from $12.60 to $102.60 for 2018. Michigan's average premium is $33.28 per month, which is used to determine the Part D penalty amount should a beneficiary apply late for Part B. This slide shows the different ways one can assist a beneficiary to apply for LIS. As stated earlier, the preferred method is online, as it is the quickest and easiest way to file an application. This slide shows the MSP income and asset limits. This information can be found on the purple sheet or in your manual. If you don't have one, your site coordinator can send you a copy. Again, as with LIS, if you feel the beneficiary is close to meeting the requirements, You should assist them in filling out an application. This slide shows where to apply for MSP. Again, as with LIS, an online application is the preferred method. So what do I do next? After you assist a beneficiary online to apply for LIS or MSP, you will get a confirmation page. Print 2 copies of the confirmation page, give 1 to the beneficiary, and send 1 to your site coordinator. If you are working in the Southfield office, you can give the confirmation page directly to Yvonne or put it in the MIPPA mailbox. This confirmation page will be cross-checked with ShipTools. If it is not entered properly, the application cannot be submitted for reimbursement. The next several slides show where and how to document LIS and MSP in ShipTools. As noted earlier in the presentation, this is a requirement of the program and is the only way to get credit for your work and for the MAP program to get reimbursement. If you are doing an LIS application, you must check 13 in Part D, LIS, Extra Help, Application Assistance, and Enrollment. If you are doing an MSP application, you must check 47 under Medicaid Age Disabled Care, Add Care, MSP Application Assistance and Enrollment. Screening can be marked, however, if that is all you have marked, it is not reimbursable. Box 7 is optional, but it does provide more complete information. Use option LIS MIPPA if box 13 is checked only. Use option MSP MIPPA if box 47 is checked only. And use both if both box 13 and 47 are checked. If counseling did not include MIPPA assistance, use option not MIPPA. Comments for MIPPA are required. Comments tell us what took place and help for continuity of care. They are also necessary for reimbursement. They are essential to creating a complete record and to provide proper documentation should the beneficiary need to appeal or should the record be part of an audit. When the forms come in to MAP Inc., they are cross-checked. If it is not entered correctly, there is no reimbursement. For an example, as noted previously, if a person is close to meeting the income and asset limits, we still encourage them to apply for MIPPA. Comments are essential in such a case as it indicates why an application was filled out when the beneficiary was above the income or asset level. If the record were audited, this would be something an auditor would look for. Comments also need to match the topic discussed. For example, while with Jane Doe, she asked for extra help assistance in prescription drug costs. After reviewing the income and asset limit, we found Ms. Doe was eligible to apply for LIS assistance. Ms. Doe applied for LIS assistance online, and her confirmation number for the application submitted is many zeros number 3. That would be something where the comments match the topic discussed and would be an acceptable comment. MIPPA also covers presentations for Medicare preventive services. Medicare Part B covers preventive services like screenings, exams, wellness visits, lab tests, and immunizations to help prevent, find, and manage medical problems. Preventive services may find health problems early when treatment works best. You must have If you have any questions about MIPPA or any other MAP-related topic, please feel free to reach out to your site coordinator. We are all happy to help you. Thank you to MAP Central, especially Pat McKinnon and Linda Kushner. Thank you to all of our wonderful volunteers. We can never thank you enough for the work that you do on behalf of beneficiaries.